AI and digital technology are reshaping the government's healthcare work by enabling agencies to address complex challenges more efficiently. By analyzing vast amounts of data, AI and machine learning are helping agencies accelerate critical research, improve decision-making insights, and enhance outcomes across various health-related initiatives. I'm Wyatt Cash with Scoop News Group, and joining us to discuss how AI and advanced technology capabilities drive innovation and transform healthcare's future are Stephen Posnak, Principal Deputy Assistant Secretary for Technology Policy at the Department of Health and Human Services, Dr. Colleen Kummet, Epidemiologist and Director of Health Analytics at GDIT, and Matt Doxey, Executive Lead Federal Health Research at Google Public Sector. Stephen, Dr. Kummet, and Matt, thank you so much for joining us. Stephen, I'd like to start with you. Given how technology is impacting so many dimensions of healthcare, how is your office prioritizing its investment strategies?
I appreciate the question. Thank you for having me. HHS is a big department, as many of you know, with FDA, CDC, CMS, a whole big acronym soup of agencies that are part of the department's overall scope. And so in an AI space where you have a high pace of change, everyone's got full-time jobs. Everyone's trying to keep up with, what the new changes are in each of the new models that are being released, and how we can apply how we can apply them to our missions. And that's really one of the challenges that we face is, helping people understand how to transition and how to evolve with this new technology and put it into our workflows. That includes budget preparations, which also often happen years in advance, and really marrying the two in terms of both technology deployment, privacy, security, other types of approvals that need to go through.
And then from a policy and implementation perspective, what are your most significant hurdles in adopting and scaling AI and ML solutions across the different arms of HHS? And how are you addressing some of these challenges?
I think everyone's got the same challenge with respect to workforce. That is something both from a talent management and hiring perspective, as well as training individuals in the jobs that they're at today. So we've stood up an HHS artificial intelligence community of practice. It's an ability and opportunity for staff across the department to share knowledge, experiences, and other types of best practices. That's one thing that we're taking on. We're also working on additional strategic plan related activities, as well as internal policies to help enable and encourage some innovation and entrepreneurship. I like to describe it as being AI adventurous. That's something we want our staff to get more experience in these technologies, so that for those that regulate it, they understand, what's coming in through those doors. And for those of us that can use it to change the way in which we deliver services for the American people.
Terrific. Colleen, let me bring you in here, if I may. What are some of the most promising opportunities where you see AI and ML being particularly well suited to address specific challenges within the federal government healthcare domain?
So applying increasingly advanced technologies, specifically for fraud detection, is a promising opportunity to maximize government savings, but also control increasing healthcare costs for beneficiaries. GDIT has successfully supported these initiatives for federal health agencies for some time using AI. And specifically for HHS, for the past 5 years, we have had AI in production for fraud detection and prevention. These efforts have cut the fraud detection time in half and have saved over $330 million for the government, according to a 2022 CFO report. We're now rapidly expanding the AI that we're using in fraud detection by adding the power of generative AI. And this is used to avoid improper payments before they are made, and then drive additional savings for the government. For the National Cancer Institute, we established a central data ecosystem to better securely share cancer research data and further enhance their ability to treat and detect new cancers. And using AI and our partner Google, we better enabled researchers to rapidly and securely access the data from over 30 types of cancer and over 20 research program data sets.
And then speaking of Google, Matt, from your perspective and kind of from an industry side of things, what else are you seeing where AI and ML are particularly well suited to address some of the specific challenges within the federal government healthcare industry?
Thanks. Great question. The federal government and all the health agencies alone, as Stephen pointed out, is pretty big and pretty vast. So there are multiple opportunities. We like to think about the art of the possible at Google and ask, can it be done? So I guess I would posit from a high level, if there's a challenge or solution that agencies are having, there's likely a way that we can leverage AI or data-driven solutions to help overcome that problem, answer those questions, and deal with those challenges. But specifically, what we see across the industry is a few key themes emerging. One of those has to do with reducing sort of the burnout and workload that many of these agencies have. So if you think about something like, say, the grant process, which can be both onerous for the researcher and onerous for the federal agency that's providing the grant, due to the large amounts of manual effort that are necessary to weed through those grants. That's a great place where generative AI can help triage and identify and work through and really empower the human in the process to do work more efficiently and more effectively. And I think that's one of those places, especially when we talk about the big federal agencies, that we don't always think about. The efficiencies and the processes that AI can help improve and make, honestly, just make better, are something that we really want to focus more and more on. But then the other part of that is all of the research, all of the life sciences, all of the advancements that we see, literally Nobel Prize winning technology through AI that can be used to identify new drugs, to identify new pathways, to identify various genomic workloads. There's just so much opportunity out there where AI now can do things that we just couldn't do even 2 or 3 years ago.
And then, Stephen, from your perspective inside HHS, can you share specific examples that you're seeing of how your office's efforts are helping to actually improve healthcare delivery or research in the U.S.? And what tangible benefits are you really starting to see where AI is really being leveraged for improving things?
Absolutely. So for those that want to follow along, you can go to hhs.gov/AI. That's going to be the page that we're going to be updating, and we'll have more information on an ongoing basis. And one of the things that we've done, which is a continuation through the years, is to publicly post the AI use cases that all of the different operating divisions and staff divisions within HHS are working on, that have deployed, are part of their mission operations. So that's a public inventory that we're updating within the next few weeks, again, for FY24. And as you probably won't be surprised that it's increased. And so I think that'll be pretty insightful for everyone to take a look at. The range of uses, really spans everything that my other colleagues just talked about: public health, safety analyses, forecasting, fraud detection, and, other types of internal uses. As Matt discussed, we're looking at changing the ways in which we do business as usual, using some of these new tools. And one of the ones that I'd highlight, which recently had a paper published, is called Trial GPT. And so we know that many individuals are eligible for clinical trials that don't know about them. And so we can use technology in this case to help match people to the clinical trials that they're best fit for, and help give that information to clinicians on the front lines. And so, it's still early, but that's a great example where I think we can change a lot of people's lives that are, in some cases, desperate to find a clinical trial, and they just don't know where to go and how to match up.
It's a great example. Thank you. Colleen, I'm curious also on another topic that's related, and that's around data privacy and security. They obviously remain a paramount concern in healthcare. How is industry ensuring that AI safeguards will be sufficient to protect sensitive patient information within federal agencies, given just how much automation is kind of driving a lot of the analysis?
Yeah, absolutely, Wyatt. And the protection of health data is paramount, extremely important and complex, as we use different forms of analytics, different forms of data collection, and the forms of the data just take different forms as well: claims, text, images, audio, etc., all that need to be securely accessed to provide necessary care by providers, accessed by patients for their own data, and then researchers, insurers, and other health partners. All of that ecosystem has to be extremely secure to protect patients. At GDIT, we follow the CISA Zero Trust Maturity Model, the roadmap and its pillars. And once assessed, those zero trust principles are then implemented specifically in automation, governance, and orchestration. All of our automation and orchestration are designed in accordance with the Google Cloud Architecture Framework, and that's to ensure that the solution meets the security best practices that have been developed while working with our customers.
And then Colleen and Matt, I'll ask this of both of you. Beyond the technology itself, what are the key factors that federal healthcare agencies really need to be taking into account now to ensure they successfully adopt and implement AI and ML solutions? Colleen, maybe you can take that first.
Thanks for the question, Wyatt. So mission alignment is essential for AI, and at GDIT, we often discuss the topic of how much is important to keep the human in the loop versus leveraging the automation potential of AI. We have helped our customers quantify the risk of AI solutions and then gauge the return on investment of engaging humans at different levels within the AI system. So for example, for high risk AI solutions, we may design a system where a human is still fully in the loop. But some of those more manual tasks that the human would perform are automated by the AI solution. In a medium risk scenario, we have implementations of AI where the human is sampling or auditing the AI performance, and that is used as continuous feedback for the AI system. And then in low risk scenarios, particularly where speed is important and risk is again low, a nearly full automation with periods of audits by human reviewers may provide the largest return on investment.
And Matt, what additionally do you see as key factors that federal agencies really need to be thinking about now to ensure successful adoption?
Yeah, I'd echo what Stephen and Colleen have both said, making sure that there is a strategy in place that keeps humans involved. And then also making sure that the mission of the agency remains central to answering any questions or driving any of that strategy or adoption is crucial. We can't lose sight of why we're doing things and why we're supporting this work, because AI is cool and fancy and we want to use AI. And part of that comes with a digital modernization strategy. So at Google, for instance, we built our cloud system specifically for AI from the ground up because we knew several years ago what was possible and the technology that we would need, a bit selfishly, to be able to do the things we wanted to be able to do at Google. All the amazing research, again, literally Nobel Prize winning research, requires a pretty intensive cloud network and a modern system. So the first things we always talk to agencies about is, let's get the fundamentals in place and make sure that those are there before you start thinking too far down the road on the more advanced stuff. And then the other big part of it, this is a socio-technical revolution we're seeing right now. And if you don't have governance policies in place, if you don't have leadership strategies in place, and if you don't have the right mentality in place, that's one of the biggest roadblocks we see to cloud and AI adoption, is just these agencies aren't ready from more of the organizational culture standpoint. And that old adage is true: culture will eat strategy for breakfast every single day. So if that culture is not ready for AI, you need to go back and start preparing yourself to adopt AI along with those fundamental digital modernization tools that need to be in place.
I appreciate that. So Stephen, looking ahead, how is your office preparing for the rapid transformation that AI will likely have on healthcare technology? And also, how are you preparing your colleagues across HHS?
Yeah, perhaps a good awkward segue for me to say we have a strategy and we're working on it. And the department actually does plan to issue an AI strategic plan this January, so very soon. And that will help set the tone for, department-wide investments and activities. Again, I'd emphasize we've got a lot of the challenges that Matt mentioned, training in our workforce, how we're going to look at enabling AI uses within the department to improve, services and other types of processes. And then equally, as a regulator, as an investor, as a supporter of the community, how we can help enable standard setting, some guardrails, public-private collaboration. Those are all other types of factors that we're going to be stepping into. And we're AI optimists, but we also believe you got to verify what's happening. You got to figure out the culture and workflow changes, and figure out what the best fits are. We have a lot of conversations now. As much hype as there is around AI, it's not always the best fit for certain solution sets. And so resisting the temptation to just throw AI at everything is equally something that is important to the conversation too.
Well, I'm afraid we're going to have to leave it there. But Stephen Posnak, Dr. Colleen Kummet, and Matt Doxey, thank you so much for joining us and sharing your respective insights on the continuing evolution of AI and its impact on the healthcare industry. So thank you so much for joining us.
Thanks for having us.
What?
Thanks.
Cheers.